Hi, I am Nurse Marsha, a retired nurse with over 30 years experience. My channel is for people who are looking for health information in order to better manage your health and also in order to better navigate through the healthcare system. So today I want to talk to you about telemedicine. Some people call it telehealth, some people call it virtual healthcare. So exactly what is it? Well, it is a replacement for seeing your doctor in the office. That's right. You can utilize telemedicine just like we did when you needed to go into the office to see your doctor. Let's talk about when did it become so popular? Well, telemedicine is not anything new, but it became more popular when we were shut in with COVID. After we started moving around more, people really loved telemedicine. So the different healthcare provider, if not all of them, decided that they were going to continue with this telemedicine services because it became very popular, and that's what patients wanted. Nurse Marsha has done telemedicine, and I simply love it. So let's talk about exactly how it works. Well, you need an appointment just like before. So you're going to call your doctor's office and make an appointment. They will usually ask you, why do you need to see the doctor? And based on why you need to see the doctor, they can best decide if you are appropriate for a telemedicine visit. So they're going to give you an appointment. They're going to give you the information on how the doctor is going to connect with you. Telemedicine or telehealth, you can utilize some type of face-to-face device through some system called Zoom, or there are a million other software systems now because it has become more popular. Your healthcare provider will give you whatever software system that they're going to utilize. Sometimes it's simply a Zoom call. Sometimes it's going to some website that they're going to give you and you sign in and you'll be able to see the doctor face to face. If you don't have an internet, or if you don't use your laptop, or even if you're not that knowledgeable on how to use your phone, you can simply do an old-fashioned phone call. It does not always have to be a face-to-face. So this is so convenient, and it has become so popular that I encourage people to utilize it. Let's talk about some of the benefits of telemedicine. Well, the benefits are convenient. It's so convenient. You don't have to take a day off work to go see your doctor. You don't have to drive in traffic to see your doctor. It has increased people's ability, or it has increased access to seeing your doctor. Some people live in rural areas and it's not easy to go to the doctor. Some older adults are less mobile. Some people don't have transportation or reliable transportation. So that has increased their ability or has increased access to seeing the doctor. Nurse Marsha has done virtual visits before I retired while I was at work on my lunch break. And do you know something else? And I think this is great. You can have mental health treatment or mental health appointments through virtual healthcare or virtual visits. I think that's wonderful. Continuing with the benefits of telemedicine, it costs less money. It costs less money for the patient, and it costs less money for your healthcare provider. So insurance companies love telemedicine. Let's talk about the limitations, because there are some limitations to telemedicine. Depending upon the severity of your symptoms, you will not be a candidate to do a telehealth visit. That's why it's so important when you call the doctor's office to tell them exactly what your problem is. If an emergency comes up, that's still a 911 call for things such as chest pain, difficulty breathing. if you have burned yourself, if you are having symptoms of a stroke, if you are having suicidal thoughts, or if you having thoughts of hurting someone else, those are still 911 calls. Some other severities in your symptoms, you will have to go into the doctor's office to see the doctors. Sometimes the doctors do have to physically examine you depending upon what your health issue is. Sometimes you will still have to go into the doctor's office if he wants to order some type of testing like x-rays or some other type of diagnostic test or blood tests. So other limitations is depending upon what treatment the doctor is going to provide for you. Some medications are what we call controlled medications or scheduled medications, such as strong pain medications, depending upon if you need any type of tranquilizers or anxiety medications. The doctor won't be able to prescribe that via a telephone or telemedicine visit. Those will still have to be done in the doctor's office. Every state is different. You can ask your provider, and he or she will know if that's something that they can do by telemedicine. Do your insurance companies cover telemedicine? Yes, most private insurance companies do cover telemedicine. Again, because it's so popular, it is less expensive. But if you've been following Nurse Marsha, you know that I'm always going to say, call your insurance company and ask. Please call your insurance companies and ask if they cover telemedicine visits. If you have a government program or government insurance companies like Medicare or Medicaid, now as of 2023, they are still covering telemedicine visits. If you have not tried telemedicine, I highly encourage you to do so. You will love it. Just do one and you will be hooked like Nurse Marsha is hooked, okay? It is so convenient. You usually will get an appointment faster through telemedicine than you would if you needed to go into the doctor's office. It's such a good way to continue to have a rapport with your primary care physicians, because I'm going to give you an insider tip. Doctors do not like it when they only see their patients once a year. So this is a great way to have an ongoing relationship with your physicians. If you found that this information was helpful, please subscribe to my channel, hit the like button, hit the notification bell so you will know when I upload a new video. And most importantly, share Nurse Marsha. Don't keep me to yourself. Bye.